Hey everybody, my name is Ryan Harmon and I'm a 5th level BSN student at Northwestern, and today we're going to talk to you a little bit about the nursing perspective in the interprofessional healthcare team. So I hope you enjoy. Okay, so what is nursing? Well, nursing is the first line of the healthcare team, so we are the ones with the patients 24/7 all the time, and we care for the patient's body, mind, and spirit, so it's on a holistic manner versus just caring for their diagnosis. So we kind of look at them as a whole. And because we are this first line of the healthcare team, we work closely with all of the other healthcare providers, whether it be pharmacy, physical therapy, occupational therapy, and so on. And another cool thing that we have is we have our own nursing diagnoses. So instead of someone saying that the person just has diabetes, we say things along the lines of this patient has an altered glucose metabolism.
So what is nursing? Nurses play a large part in patient advocacy. We are the role that goes between the patient and their wants and their needs to the doctors. We are the ones that make sure that the patient's best interest is always kept in mind. We also play a large part in educating our patients when the doctors prescribe orders, and we have things from maybe physical therapy. We are the ones that make sure that this information is enforced to the patient and that they actually understand it, so when they are sent home, they can also comply to their regimen. Nurses play a large part in collecting data for research. We are always at the bedside, and we are the ones who get to see the results from things that are put into place by doctors and by pharmacists, maybe even physical therapy. We are the largest segment of the nation's healthcare workforce. If you just want to take a minute, think about how many nurses you see on the floor versus how many doctors or respiratory therapists or physical therapists you'll actually see. It's very, very large difference. Lastly, it can be easy for nurses' part in healthcare to be overlooked. However, we are a main component in making sure that all these allied health workers and the patients are active in communication and that all the information is received.
Where nurses interact with patients. Nurses interact with patients in every part of the healthcare system, such as patients' home, hospitals, doctors' clinics, nursing homes, nursing specialists, and school nurses. As some fun facts, registered nurses also can obtain certifications to become an Botox injector, so be expected that nurses to give you Botox at a cosmetic clinics. So one day we can straighten those wrinkles.
How nurses interact with patients. Nurses interact with patients in every part of the healthcare system. I'll use the ER as an example. There are triage nurses that help assess the severity of patients' needs. Then there are the nurses that work like other nurses on the floors. There are also nurses that can assume care after the ER nurse's shift is complete, or if our patients need to be moved to another area of the hospital to be better treated. After a nurse assumes care on the other floors, it is now their responsibility to care for the patient in question. Nurses do a thorough assessment, administer medications, and we are the patient's advocates to the physician and even to the patient's family. We use therapeutic communication in order to let them know that we are there for them. We establish good rapport, we make sure to avoid medical jargon, and we evaluate their educational and functional levels in order to talk to them on a level that they can understand.
Educational background of nursing. A RN can pursue a 2-year associate's degree or a 4-year bachelor's degree. During the clinical portion, we must obtain 1,000 clinical practice hours. After graduating from that said program, you must complete the NCLEX exam, also known as the National Council Licensure Examination. It is a standardized exam that each state board of nursing uses to determine whether or not a candidate is prepared for entry-level nursing practice. Further education of nursing, you can get certifications, master's degrees, DNPs, or a PhD.
The world of nursing is meeting a bigger demand each day. Because the nursing profession represents the largest segment of the healthcare world, it is crucial that nurses everywhere and the future of nursing is ready and equipped. With our world population growing and diversifying, healthcare always changing, and the average age increasing, nurses' responsibilities, roles, and depth of education should grow as well in response. Also, the world of nursing needs to adapt in the ever-evolving world of healthcare. As we all know, healthcare is one of the hot-button issues facing our nation. It is important for nurses to stay up to date with what is going on and how it will affect our methods of care and our patients. So some of the key messages for the future of nursing are that nurses should practice to the full extent of their education and training. Nurses should also achieve higher levels of education, such as nurse practitioner or CRNA, and also achieve training through an improved education system that promotes seamless academic progression. Nurses should be full partners with physicians and other healthcare professionals in redesigning healthcare in the United States. Effective workforce planning and policymaking require better data collection and information infrastructure.
Tools that nurses use in the healthcare setting. Vein finders, they find your veins. IV pumps, IV machines, assessment tools such as stethoscopes, glucometers, portable pulse oxes, urinary and fecal catheters. Also, we play with all kinds of needles. The larger the number, the smaller the needle.
When and where will you see a nurse? Nurses play a role in the assessment and treatment of all sorts of diseases such as sepsis, heart failure and flash pulmonary edema, hepatic encephalopathy, cystic fibrosis,
Diabetes.
trauma, stroke, respiratory failure, and heparin-induced thrombocytopenia.
And this concludes our presentation. Thank you for listening.
Pork 'em, demons!